How do doctors interpret brain tumor test results? When it comes to understanding how doctors interpret brain tumor test results, it's a detailed and careful process. Doctors gather information from various sources, including imaging studies, tissue analysis, and molecular testing. This helps them determine the type and grade of the tumor, which is essential for planning treatment and understanding prognosis. The journey typically starts with brain imaging. The most common method used is magnetic resonance imaging, or MRI. This technique provides clear and detailed images of the tumor's location, size, and characteristics. To help standardize the interpretation of these images, doctors often use structured reporting systems like the Brain Tumor Reporting and Data System. This system quantifies findings and assists in making clinical decisions. Higher scores in this system often indicate a greater likelihood of needing changes in treatment. Once imaging is complete, the next step usually involves a biopsy or surgical resection. This procedure allows doctors to obtain tumor tissue for examination under a microscope by a specialist known as a neuropathologist. The pathologist looks closely at the tumor cells to assess their appearance and growth patterns. This assessment helps assign a tumor grade, which typically ranges from 1 to 4. Grade 1 tumors grow slowly and look more like normal cells, while grade 4 tumors grow rapidly and appear very abnormal. This grading is crucial because it helps predict how aggressive the tumor is and influences treatment options. In addition to examining the tissue under a microscope, modern diagnosis also includes looking for molecular and genetic markers. These markers can provide additional insights into the tumor's characteristics. Tests for specific mutations and other markers help distinguish between different tumor subtypes and can even predict how well a patient might respond to certain therapies. For instance, mutations in the IDH1 or IDH2 genes often suggest a better prognosis. Advanced imaging techniques, such as magnetic resonance spectroscopy, can also play a role. This method measures brain metabolites and helps differentiate tumor grades without needing invasive procedures. By analyzing markers of cell growth and tissue damage, it can enhance diagnostic accuracy, especially when distinguishing low-grade gliomas from non-cancerous conditions. Finally, doctors synthesize all the gathered information, imaging results, tissue analysis, molecular data, and clinical findings, to estimate the tumor's behavior and prognosis. This comprehensive approach allows for personalized treatment plans, which may include surgery, radiation, chemotherapy, or participation in clinical trials. It's important for patients to discuss their tumor grade, type, and treatment options with their healthcare team. Seeking a second opinion can also be beneficial for clarity and reassurance. In summary, interpreting brain tumor test results is a complex process that combines various diagnostic methods. This thorough approach ensures that patients receive tailored treatment plans that best suit their individual needs and circumstances. Always remember to consult healthcare professionals for personalized advice and information.